Hey Facebook land, this is Dr. Diane Krieger. I wanted to thank everybody for chiming in about what your suggested topics of conversation would be this month. We had a lot of requests, and the one I wanted to talk about right now is acupuncture versus acupressure. So I've been an acupuncturist since 1985. I really love doing acupuncture. I'm working on a lot of patients right now to help them quit smoking. I'm doing some neuroma patients and some general stress patients. For nurses and things like that can be very helpful. So at any rate, I like both of them, and sometimes I will incorporate both with one treatment. I especially love the needles, because when you do a needle, it is very pinpoint, obviously, and it goes deeper. It goes very deep, and you try to reach something called the Da Qi, which is the energy reaction that you try to get from the right placement of a needle. The Da Qi, sometimes I jokingly say it literally translates to mean, oh shit, because when you feel it, you're like, ugh, and then it kind of dissipates, and while the needle's in there, because we leave the needles in about 20 minutes, you really feel kind of a diffuse energy sensation. It shouldn't be terribly painful, but you should feel something. So I prefer needle placement when we're trying to do some accomplish things with acupuncture, but acupressure can also be very, very successful. So you could probably Google acupressure points for headaches and do it on yourself and get some relief. But if you want to ever try some acupuncture, I'm happy to try it with you and talk to you about it. And typically we use 12 to 16 needles per condition, depending on what you're complaining of. So love to do acupuncture. I have some information for you about it as well. So next time I see you, just let me know.
Dr. Diane, isn't it true that in the web space, that's the good headache point, is it not?
This is large intestine 4, or also known as Hoku, and you are correct. It's good for anything head and neck related. It is very tender. If you go to the end of the crease and push in, you will feel an electric shock sensation. It'll be like, ah, that's it. And when you do press it, you will feel a dissipation of your headache or your neck complaint. And you can do both hands. If you're right-handed, it's probably a little more effective to do your right hand, but always do both. I needle these probably every single time I do acupuncture, because they're great endorphin releasers.
Perfect.
So yes.